welcome to Read Scholars Live. I'm your host, Dr. Mary Fleming, current president of Read Scholars, and I am super excited today to be joined by Dr. Jerome Adams. He is an anesthesiologist, the 20th Surgeon General of the United States, and is currently at Purdue University. Hello, how are you?
I am doing well. Great to be with you today.
Good. I'm so excited to have this conversation with you. Just for your breadth of experience, all the things, and your your experience surmounts so many other Surgeon Generals in the past, as well as your experience across the board from your service in Indianapolis, where you are now, to our nation's capital and back. And so, looking forward to jumping in the conversation today. So I would like to first start with, I'd like to ask our guests just, a little bit about you, where you're from, where you grew up, how did we get here? And so I'm currently in Columbia, Maryland, and I know you grew up not too far from here. So tell us a little bit about, your family and how you grew up and how you started out on this path.
Well, it didn't grow up too far, but it still seemed like a world away. I was about an hour and 15 minutes, an hour and a half south of Columbia, Maryland, in St. Mary's County, Maryland. And for the listeners out there, St. Mary's County was considered part of the South during the Civil War. The Mason-Dixon line runs through Maryland, so it's one of those states where you have again, both North and South, and in very different cultures and very different parts of the state. St. Mary's County is also very rural. Um, my high school, Chopticon High School, was nicknamed Cow Pie High. And that is because we had a very robust agricultural component to our educational system there. More people graduated to become farmers than graduated to become doctors from my high school. But what I think is most relevant about where I grew up is something that I still continue to work on today here in Indiana, which is another state that is that has quite a large rural population, and that's the barriers that relate to access. Um, Access to healthcare providers. In my book, I literally talk about one of the two times I almost died growing up. And interestingly enough, both of those times I almost died were largely related to access to healthcare issues. Um, I talk about lack of access to other opportunities to be healthy. And so just really quickly, I'll tell you the story that I begin my book with, and that's the first time I went to Washington, D.C. And the first time I went to Washington, D.C. was in a hospital. I was medevaced from the rural community that I grew up in to Children's Hospital in Washington, D.C., because I had an asthma attack. And like 1 in 9, 1 in 10 people, and disproportionately higher in African Americans, and particularly African American boys, I have asthma. Unfortunately, again, I grew up in a rural community, so every time they would till the fields, every time they would the combines would come through, it would stir up dust, and that dust would, in many cases, trigger an asthma attack for me. And so during one of those times, I had an asthma attack so severe that they had to medevac me. Uh, the nearest hospital to where I grew up was about 45 minutes away. It was a critical access hospital. They didn't have a pediatrician on staff. And so I still remember to this day my mother taking me to the hospital in the back of a car because we didn't have a full-time EMS service, so they couldn't call an ambulance. My parents had to transport me, and by the time they got me there, I was almost dead, and they didn't have a pediatrician, much less a specialist available to diagnose and to give me state-of-the-art treatment. So they called a hot helicopter and shipped me off to Washington, D.C. And so again, I grew up long before we started talking about the concept of health equity, and long before these debates over diversity, equity, and inclusion. But I intuitively knew that there was something about who I was and where I grew up that was causing me to continue to be sick. and that was potentially limiting my ability to grow up and to achieve all that God had planned for me to achieve. And so. Um, uh, so many more ways we could dig in deeper to that. I think also relevant is the story I often tell about my brother. And I tell this with his permission, but my younger brother has substance use disorder. And at this point in his life, he's around 45, has spent most of his adult life incarcerated, back and forth in jail and in prison due to crimes he's committing to support his addiction. And growing up in a rural community, there was stigma against acknowledging that you had mental health issues. There was stigma against going in to get treatment, even though, again, many people were forced to self-medicate. There was lack of access to psychiatrists, and there's still lack of access to treatment. And my brother, unfortunately, despite the fact that his brother is the former Surgeon General of the United States, still has not been able to find access to high quality, easily accessible treatment to help him get on the pathway to long-term sobriety.
So much there. One of the things I was thinking about is I was talking to a mentee yesterday, and I was saying the same thing. Like, I'm around from the time which we didn't have the word health equity, right? The vocabulary has changed, but to your point, we knew growing up something wasn't right. There was
Hmm.
clearly a stark difference in like how do we figure out what we can do to address that. The other thing that I thought about too is, and I didn't mention this to you when we were talking previously, so I do locums and I've done a lot of work in rural America. And one of the places that I worked was in rural Oklahoma,
Hmm.
and and the
Where in Oklahoma
closest
have you been?
Guyman, Oklahoma.
Okay.
It's
Yeah, I've
in
done
the
work in
Panhandle.
Durango, Oklahoma. I've done work outside of Oklahoma City with Chickasaw Nation. For the listeners, Oklahoma, incredibly rural, incredible distances between people and actual hospitals and offices. In many cases, healthcare and pharmacy deserts, but also a large Native American population and a lot of tribes. And so a lot of my experience in Oklahoma, interestingly enough, was as Surgeon General when I went out there because a lot of the officers that the Surgeon General oversees, public health service officers, or doctors, nurses, and pharmacists who work for Indian Health Services. And as you mentioned, it is mind blowing. Particularly for someone from Columbia, Maryland, so, people who may not have had that experience of living in rural communities to go to a place like this and see that wow, the conditions there are in many cases on par with developing nations.
Yeah, it's amazing. I mean, like at least to the closest when the hospital that I worked at, the closest um tertiary care center was 2 hours away in another state, right? So, and
Hmm.
when we think about policy issues, and you talk a lot about state. I think you say that well, I don't think this is your quote, but you quoted it that the governor makes more impact on your health than your doctor, right? So very local decisions. But if you have to cross state lines, and then it changes everything, right? So that again, that's a longer conversation for another day.
No, but
Um,
I think it's relevant to the conversation we're having today. The quote you're talking about, Brian Castrucci from Trust for America's, or from the De Beaumont Foundation, is
yes,
the
that's
one
good.
who framed it this way. And I talk about it in my book. Brian said, "Your governor has more control over your health than what your doctor does," and that's something I have seen over and over again throughout my careers, and it's something that I have had to constantly explain to people. We look at America as a monolith, and it's easy for us to think that health policy is determined by the White House or by CMS or CDC in Washington, D.C. The reality is, constitutionally, most of the authority, particularly around health, is at the state level. It's your governor who decides whether you have access to an abortion or not. It's your governor and your legislature who decides whether or not you have a syringe services program in your state. And one of the things that I did in Indiana was help get syringe services programs legalized to respond to an HIV outbreak that we had in rural Scott County, Indiana. It's your governor who decides whether or not, in your legislature, whether or not you all use the Affordable Care Act funds to expand access to coverage through Medicaid. And so I think for the listeners here, international and national, who aspire to be leaders, it is important to understand that yes, Washington, D.C., the White House is important. They are important, but ultimately, a lot of the actual day-to-day decisions are made by your governor, your legislature, the local community you live in. Vaccine policy. That's often school district by school district. And certainly, the federal government can't compel any particular state to adopt a vaccine policy, which is why you're seeing Florida right now having a conversation about getting rid of all school-based vaccine mandates, whereas other states are saying we're going to hold firm to our vaccine mandate. It is a much longer conversation to go into, but I think it is a fundamental variable that we need to understand and that folks often misunderstand when they think about health policy in the United States.
Yeah, I agree. And taking a slightly tangential thought to that, because I want to go a little bit more into your journey, as for the students listening, especially from following up from that conversation. And so your path wasn't exactly linear, right? And so you didn't say, I'm gonna grow up and be a Surgeon General of the United States. And so in thinking about, what you knew from your experience as an individual interacting with the healthcare system, what you learned going through your educational journey, and then how did you decide that you wanted to be a physician and then be a physician who was going to focus on health equity, to be able to talk about these things, not just from an academic standpoint, but from reading your book, your focus has always been, how do I take this information and translate it to the people who I know need it most, right? So how do you bring it back? So tell us a little bit about how you got there.
Yeah, another great question. And so, where to begin? I actually taught a class yesterday at Purdue University, and when I'm speaking with younger people or people who are earlier in their career, I often say that it's important to know where you think you want to go. Because if you get in the car, you've got to come out of your driveway and turn right or left. You've got to know if you're going north or south. You have to start in a direction, but more often than not, life doesn't lead in a straight path from where you are to where you think you want to be. And more often than not, life is about the exits and the detours that you take along the way that may completely redirect and change your path. And so my story, I grew up, like I said, in a community where most people went on to be farmers, not doctors. And certainly I had never met a black doctor growing up. So that wasn't even on my radar screen. But that said, both my parents were school teachers, and I excelled in STEM classes and was encouraged to pursue STEM. And I actually went to college thinking I was going to be an engineer. I went to college on an engineering scholarship. So I say that because, first of all, making sure even if you don't think you want to be a doctor, or don't think you want to go all the way in terms of pursuit of a degree, taking the harder classes, and particularly in regards to STEM, leaves many options and doors open to you. So I started off in engineering and I did research. And I actually did a study abroad in Holland. That's another lesson I give to students all the time. Travel as much as you can. One of my favorite quotes is from Mark Twain. He said, "Travel is fatal to prejudice, bigotry, and narrow-mindedness." Um,
Mm.
And so I was in Holland actually doing research with a gentleman who was an MD PhD, and I was in his PhD lab. But I went on rounds with him in the hospital and realized, I kind of like this patient care thing. So that opened my eyes to something that I otherwise wouldn't have been exposed to due to my rural upbringing. And then came back to school in Maryland at UMBC, which is my undergrad. And Dr. Ben Carson, who was at Johns Hopkins at the time, was giving a talk, and I got to hear him speak. And I said, "Oh, I guess there are Black doctors." And I think that speaks to the Reed Scholars and the importance of mentorship um, and of visibility. And I would say to even the students who are listening to this podcast, someone else is looking at you right now and thinking, I could never make it to medical school. I could never make it to college. And so even as you're looking for mentors, realize that you have the capacity to mentor someone right now. You have the capacity to inspire someone right now. So those two opportunities that I had opened my eyes to the pathway of medicine, and I took my MCATs and did well. And I did well because I had taken most of the classes I needed for my MCAT in my engineering program. I'd actually taken the harder physics class because I thought I was going to be an engineer than the one that the pre-med students make. And so that left doors open for me to change my mind and went to medical school. Got to medical school, thought like most medical students going in, that I was going to go into primary care. And that, interestingly enough, is also about exposure. Um, Fortunately, most of us are pretty healthy. Most of us don't know specialists and don't get the opportunity to find out, okay, what does an endocrinologist do? What does an OBGYN do? And so most medical students come in thinking they're going to be a pediatrician or a family practice doctor or an internist because that's who they see growing up. And there's nothing wrong with that. We need more primary care doctors. But I went in thinking I was going to be an internist. And it wasn't until the very end of my medical school training that I got a chance to do an anesthesia rotation. And I get, okay, I kind of like this. And I actually started off in internal medicine because it was too late to pivot. At that point, I'd already matched in internal medicine, and then I switched into anesthesia. So again, lesson there is that it's never too late to pivot, as long as you haven't slammed any doors behind you or burned any bridges behind you. And really enjoyed and still enjoy being an anesthesiologist. I still practice 1 day a week at Eskenazi Health in downtown Indianapolis, a level one trauma center. But I also got involved with the American Medical Association student section when I was in medical school. And that's what gave me the bug for policy. It helped me understand that, okay, there's being a individual doctor who takes care of patients one-on-one, but there's this broader health policy space that is determining the payment that you get for different procedures, just determining what you get sued for versus what you wouldn't get sued for. That determines everything from the drugs that are available to you to the devices that you're able to use in a surgery or on a procedure. And so that's what got me involved in that space and got me on the radar screen of legislators and policymakers like Mike Pence. So Mike Pence, as many of you know, was the vice president of the United States, but prior to that, he was the governor of Indiana, and he needed someone to run his state Department of Health. And my name got thrown into the hat for that because I was on the board of trustees of my state medical association. And if you're hearing a theme here, that's on purpose. My pathway to leadership really was through organized medicine, through the American Medical Association, through the American Society of Anesthesiologists, my specialty society, and my medical societies. And so I became health commissioner of Indiana during some particularly hot times, Ebola, Zika, the HIV outbreak that I mentioned earlier, and did a decent job handling them. And then Governor Pence became Vice President Pence, and that's how my name got thrown into the hat to be Surgeon General of the United States. So that is a extremely abbreviated version of a much longer story, but hopefully the listeners here took some lessons from hearing me. Number one, that again, it's not a straight line. Number two, that it's okay to pivot. Number three, that the more tools that you have in your toolkit, and in many cases those tools come through schooling, but they can also come through your associations with people and with organizations. The more opportunities you're going to have in the future, and the more doors that will be available to you in the future. And so that's me in a nutshell in terms of going from rural St. Mary's County to Surgeon General of the United States.
Amazing, amazing. You know, a couple points to highlight. I decided right when I was little I wanted to be a doctor, but I decided I was going to be a pediatrician. To that point, that was the only doctor I'd met at that point, so I didn't know what other doctors there were. And then through a series of other choices, now I've made it to being an OBGYN. But I also want to underscore the importance of being involved in organizations. And
Mhm.
so I was in SNMA, Student National Medical Association, still involved in NMA. And so I've actually heard you speak a few times at the NMA as well. And so, to your point, it's not just about being involved in these organizations as you're growing up per se, but staying involved, right, as a
Mhm.
professional, giving people the opportunity to see what's possible. And I think a lot of times, even as grown-up doctors, you don't necessarily know what else is out there and how else you can impact change, right? It's a continual growth and evolution. So I appreciate that you kind of keep feeding into that. Like the pipeline doesn't stop when you get to medical school or residency. The pipeline continues to grow, and we can continue to be influential and leaders in different ways, as we are grown-up doctors, if you will.
And I'm glad you mentioned SNMA, because that was an important organization for me also. They allowed me the opportunity to see other people who looked like me, and to hear their successes, but also their challenges. One of the hardest things is, the imposter syndrome that you get when you're a person of color, and to hear someone out there validating that, oh yeah, I'm struggling in this particular class, or I'm not sure if I can make it in this particular specialty area. But then also to see doctors at SNMA who have made it, who have been successful. They gave me the opportunity to present early on in my career when other specialty societies might not give, someone with my background and limited experience the opportunity to present. So I would say to the students here, and to the doctors who are still sometimes searching for mentors and searching for inspiration. The National Medical Association meeting is a great meeting, and I was just at the one that they had in Chicago earlier this year. I've been the last several years to the National Medical Association meeting.
Yeah, absolutely, absolutely. I co-sign 100%. So I'm going to pivot a little bit because I know we don't have too much time, and I definitely want to get to your book. And so I will say I was super impressed by your level of vulnerability in the book. I mean, you were a very open book to me. I mean, I don't know you that well, but you came across as being very much open book, and talking about opportunities, talking about challenges, talking about pitfalls, talking about what we could have done differently, being very honest about what you thought you could have done differently. So I thought you were very just open and honest. So I just wanted to acknowledge that. I thought and it was also a very easy read. Like sometimes when you read these non fiction memoir chronicles, you're like, but it was very approachable. And I just wanted to acknowledge that it was just a very approachable book. And so I appreciate you being very open and honest. And
Well, thank you
also,
for saying that. And I want people to know that I didn't write the book to make money. It was a very interesting experience. I've written journal articles, I've written textbook chapters, but writing for a broader public audience, and having to work with a publisher, was a very different
I can
experience
imagine.
for me. And so I wasn't writing it for profit. and I haven't made any money off of it. I give away most of my books. Anything that I make, I essentially use to be able to give books, particularly to students, because again, I know that I didn't have a lot to read or folks to that I could easily reach out to for inspiration or validation when I was younger. But it's written, of course, in the context of COVID and the COVID response, because I think it's important for us to be able to say, okay, this difficult thing happened. We did the best we could at the time, but could we have done better? And so I am very honest about the mistakes that we made. And really trying to give people a deep dive into the variables that led to a particular decision at the time, so that in the future, hopefully, we can do better. And that's what frustrates me about where we are in society right now. We're so busy finger pointing, looking for someone to blame, or defending ourselves, that we still 5 years out aren't having true, honest, nuanced conversations about what happened during the pandemic. And it breaks my heart to see that we're actually going backwards in many areas when you look at vaccine policy, when you look at trust in governmental institutions. And so I think it's important that that we allow ourselves to be vulnerable, and that we create a space for people to say, okay, yeah, that was not as ideal of a response as I would have liked, and own our parts in it, but really through the lens of not saying, you're bad or you're wrong, but how do we all do better moving forward? And we talk about that in the hospital all the time. We talk about peer review and creating a safe space to look at near misses and to look at mistakes that were made, not again so that we can blame and shame, but so that we can improve our processes moving forward.
Absolutely, absolutely. And I also wanted to say, the way you described your mother, I feel like I would just love her to death. She sounds just like mine. um, and so you talk a little bit about, I mean, you didn't know you were going to walk in the COVID-19 pandemic, right? When you accepted the job, and thinking about choosing to do the position or I shouldn't say choosing, accepting the position in the time and the administration that you did, and then having to make such tough personal decisions around family, around dealing with the colleagues, if you will, during that pandemic, because it was so polarizing. It was so, I think, disheartening, right? At some points about things that were going on. Give us a little, we don't have time to do the deep dive, but give us a little bit about, like, how did you work through that? I mean, it just seems so heavy.
So yeah, I'll try to distill it down for folks. The question I get from audiences, and that many of your listeners are probably thinking right now, is how could you work for that man? How could you work for that administration? Why didn't you leave? Those are the different versions of the question. And what I would say is that every job that you have in your life, you're going to have times in almost every job you have, you're going to have a boss of some sort. Even if you own your own company, you still have customers who you have to be responsible to, and you're not always going to agree with your boss. That's not just me and Donald Trump. That's every person out there who's generating money through some sort of employment, even if self-employed. And so the question you have to ask yourself is not, do I agree with my boss 100% of the time, but am I able to do more good than harm in this position? Am I, because I asked myself every day, am I doing more harm than good? And there was no point at which I felt I was doing more net harm by being there than the good that I was able to accomplish. And what's interesting is I'm actually having a little bit of a renaissance, if you will, right now in terms of people's opinion of me. Because very similar to public health and health equity, it is very hard to quantitate harm averted.
Mm,
It's very hard for people to see the harm that was prevented from being done, whether it's through vaccinations or clean water or me working in the White House. And so, in turn, it's very easy for people to say, well, that doesn't matter. Those vaccines don't matter. The CDC doesn't matter. You being at the White House doesn't matter until something bad happens. And in a very unfortunate but true sense, again, you mentioned being vulnerable. I'm just very honest. Right now, all that's going on in Washington, D.C. is showing all those people who said, "How could you stay?" The benefit of having someone with a public health background, someone who understood health equity in the White House, and what could happen and what is happening when you have someone in that role who thinks very differently than I did. And so you have to ask yourself, okay, am I doing more good than harm? You have to ask yourself, could I do more good somewhere else? I think
Hmm.
that is another important question because you could be doing a little bit of good in a situation, but you might be able to do more good elsewhere. I was the second African American male ever to be Surgeon General of the United States. I was more often than not the only person of color in the room. I was more often than not the only person who grown up on government assistance programs and from a rural community in the room. And so I'll be frank. At no point that I think I could do more good outside of the White House complaining than I could inside the White House, actually advising the president and the cabinet of the United States. And again, I think people now are starting to realize that, but it took 4 years of me serving the president in the United States and another 4 years of the Biden administration. People yelling at me and attacking me before now people finally go, oh, okay, I get it. Yeah,
See
you
what
were
you're
doing
talking
some good while you were there. And then the final thing that I think is important to acknowledge is you also have to be aware of your own mental health and your own tolerance. And I say this because um, it took a tremendous toll on me, but I think that's where my background and training as an anesthesiologist comes in. I'm used to being very pragmatic. I'm used to having to be calm when everything else is going crazy around me, and God has blessed me with some tough skin. But for other people out there, they just in no way, shape, or form could wrap their heads around working for an administration that they thought was doing harm in so many other ways, and that's okay. I want people to know that is okay if you say that's not something you could do. But what's not okay is telling other people they shouldn't do it either without recognizing, again, the good that they are doing or may be able to do by being in those very unique roles.
Yeah, absolutely. And like I said, it seemed real heavy to say the least of everything you went through. And I will encourage people. I mean, you told some very personal stories that I mean, you got grit. I'll say that. Um,
Well, we don't have time to go into the story, but to give people a teaser, I tell a story about when Oprah Winfrey and Colin Powell called me one weekend because of a particularly dicey situation that I found myself in, and they both encouraged me in very unique ways, and so I've been blessed throughout my life to have people in my life who I could lean on during tough times. That helps you develop that grit. And they both, Oprah and General Colin Powell, encouraged me to stay despite a lot of the rhetoric from my own community encouraging me to leave at the time. So if you want an interesting story, check that one out in the book.
Yeah, it's good. I co-sign that 100%. I know I have to let you go, but I do want to, as we close, talk a little bit about present day. So here we are. We've gone through this. We've many lessons learned. We're still having a conversation about vaccines across the board, not just the COVID-19 vaccine. But give us a little bit of, I guess, insight on where do you think we are now, and what is your current advice for the American public and beyond as we continue to have this conversation around vaccines?
Yeah, we're in a very bad place. Now, again, being 100% frank with you, what do I mean by that? We have thousands of cases of measles, more cases than we've had in 30 years. We've had two deaths from measles this year. We've had two deaths from whooping cough. We're breaking all sorts of records in a bad way as we're seeing vaccination rates drop. We went from 95% um, vaccination rates for school age children nationwide down to 92% for MMR. And we know when we drop below 95%, we're going to start to see more outbreaks. We're seeing the current administration just completely dismantle um, vaccine infrastructure, development of vaccines. They defunded mRNA vaccine technology. And along with it, they're destroying the Americans' trust in vaccines and in government structures. So we are in a very bad place. My advice to people, number one, personally, talk to your doctor. Because while trust in healthcare at large and in government institutions is at a historic low, and people still say that they trust their doctor, their nurse practitioner, their dentist, their pharmacist, first and foremost for health information because they have a personal relationship with them. And so as we close, an important quote, and I love my quotes that I always try to impart to people when I have a chance is that people need to know that you care before they care what you know. And so that relationship matters. And making sure you talk to your doctor, not that you listen to someone on the internet, because and this is what's scary to me, is we all think we're seeing the same thing when we log into CNN.com or FoxNews.com or Facebook or Twitter or Instagram or TikTok. No, we're not. We're all getting individually curated feeds based on algorithms that are designed to maximize our engagement. And what are the two emotions that maximize your engagement? Anger and fear.
Mm-hmm.
And that's basic psychology. And so they're sending us things to enrage us, to anger us, to make us afraid. And we think that it's news, that it's objective news that everyone else is seeing. And so I tell folks, don't trust what you read or see online. If you have questions, go to your doctor, go to your nurse practitioner, your pharmacist, your dentist, the people you trust who know you. That's the most important thing I can say. And then to folks who are thinking more on a higher policy level, use your voice. Share the stories of your patients with policymakers. Talk to policymakers. Say, hey, I'm a health practitioner in your district, and this is what I'm seeing. In my day-to-day life. And these are the barriers that exist for my patients. And these are the things that are working well. Because in many cases, what I found in Washington, D.C., and I know many people don't believe this, but most individuals who I've run across, and when I say most, greater than 90%, are well-meaning. They truly are. But they're just very ignorant. And I don't mean ignorant in a bad sense. I mean it in the very literal sense of the word. You've got lawyers making medical decisions. You have people who ran their own businesses or got in politics for whatever reason, but know nothing about health, making incredibly consequential health decisions. And so you need to lean in with your voice by calling your legislators, your congressmen, your senators, your governors, and telling them, what the reality is in your area, how Medicaid is impacting you positively or negatively, how access to drugs is impacting your patients one way or the other, how the malpractice climate is impacting your area and hospital closures. And if we do that, we will be able to lead to better policymaking and a better environment. W. Edwards Deming, I told you I love quotes. I'll leave you with this one. He's a famous systems engineer. He said, a bad system will beat a good person every time. And he also said, every system is perfectly designed to deliver exactly the results that it does. So nothing that's happening in healthcare right now is happening by coincidence, by mistake, by happenstance. And no matter how well intended you are as an individual, you are never going to be able to achieve optimal outcomes for your patients if you're operating in a bad system. So do all you can to create broader systemic change.
Absolutely. The system is designed to achieve the outcomes that it was designed for. Um, so as I let you go, what are you looking forward to in 2026? What is your silver lining? What do you think is
A
on the horizon?
couple of things that we can close on. I'm really excited and a little anxious, but excited about AI and technology.
Okay.
Um, I really do believe we are at a watershed moment in history in regards to healthcare. And when you look at things like AI scribes, when you look at things like AI assisted portable ultrasounds or digital stethoscopes or wearables, we have an ability like never before to actually deliver personalized care to patients based on real-time feedback and to make healthcare providers' jobs easier. And so I would encourage our listeners to learn all you can about AI, to embrace technology. I was on a panel with Mark Cuban. And people asked him if AI was going to take certain jobs, and Mark Cuban said something that I'll share with you. He said, AI is not going to take your job. The person who knows how to use AI to do your job better is going to take your job.
Mm,
So learn all you can about technology and health because it's really we're in the industrial revolution, if you will, of healthcare in regard when it comes to AI. So that really does excite me, but it's moving fast, and if you don't lean into it, you're gonna be left behind. I also am quite frankly excited that next year is an election year and that people are really starting to I think see the what happens when they don't make their voice heard and lean in. So I'm hopeful that next year will be an opportunity for us to have some deeper, some more meaningful discussions about what we want the future of health and healthcare in this country to look like.
I love it. I love it. Thank you so much for taking the time to have this conversation. Like I said, to be just so upfront and honest and vulnerable and really share your experience, lessons learned, and I think those are great things to be optimistic for and just opportunities, right, for
Mhm.
2026. So I really appreciate that. Thank you so much. From me, from Reed Scholars, from our listeners. Also, I did want to give a shout out to Don Lee, who introduced us. I really appreciate the introduction uh, and looking forward to seeing what the next steps on your career will be.
Thank you so much. I appreciate it. Great talking with you, and happy holidays to everyone.
Happy holidays. Thank you so much.